Thank you for coming to this meeting today with me. I'm the head coach of the men's basketball team. Tell me about your background with the sport and in this profession.
So, my name is Chrissy Dow. I am a sports psychology consultant, and my background is previously I got my undergraduate degree in athletic training, and so I do have an idea of what basketball is like, especially both men and women's, both at the high school and the collegiate level, because I did work with them throughout my clinical experience during my undergrad, and then currently I am a sports psychology consultant, hoping to work with you or at least at another college university. And I understand that with basketball, there is a lot that goes into it. And I understand that it's more of a teamwork type of environment instead of individualistic because there's 5 individuals on the court, but they have to work together as one in order to become successful and create a successful play and score and win. Also, with the sport, I do understand that it is a closed sport, meaning that it is within the walls of the gym from the end line to the end line. It's not necessarily like soccer where it's field to field and then it continues to go and whatnot. And then with basketball, knowing how injuries work, I know that basketball is technically considered a non contact sport, but there is contact that still happens during it. And so knowing how individuals react to stress and pressure will also kind of help determine on how they deal with that stuff and how they cope. And the way that they act on the court will also determine their type of personality on the field and off the field. My goals for this meeting, obviously you had called me in and had me come talk to you, and I'm hoping that by the end of this you kind of understand what I do, what I can offer for you and your team, and hopefully I will be able to get to work with you guys with the men's basketball team. And if you have any questions, feel free to ask. I do want to make note that I will be taking notes just so that I have an idea of what you're wanting, just so that I can make note of that and have references for later on.
I want to have a successful season as a team and a season where my athletes listen to me. The team needs help with their performance and confidence. They are a very good support system but need to work together.
Okay, so you had mentioned that the team does work well together support-wise, but they need to do better in working together as a team outside of just the support system, and that they need to work on their performance and their confidence. And then, have you ever worked with a sport exercise psychologist before?
No, the team and I have never, and we are a little hesitant to see if it works.
I understand you're being hesitant about it. It does seem kind of strange having a random stranger come in and be a part of your team where you've built it over the years, whether it's been 4 years or just their first year. It's still weird to have someone random come in and kind of tell you what you should and shouldn't do and how you should act to benefit your team. It's just a stranger is being brought into like a family type of environment. And so this is what I can do for you. I work with specifically sport performance enhancement, and so obviously that's something that you want. You want to better your performance as a team. And so with performance enhancement, in my programs that I create, I always include the coaches and the team members because obviously from what I can see from the outside is not everything that happens within the team. There's something that I don't see, and there's some things that maybe you see or you notice, or things that you want to work on. And so including you on things that you want to work on, such as having the team listen to you a little bit better, is something that I will work on, such as leadership skills. And then with the team, you wanted them to work on their confidence, and that is something that I also work with, is confidence building through different psychological methods. And being able to work with the individuals on the team as well on things that they want to work on. Say that the whole team as a whole wants to work on creating a better way of just communicating, but there's individuals on the team that want to work more on their personal self-esteem or confidence. Then that is something that I would also incorporate into the plan as a whole, because sometimes people often do tend to be outspoken, and so say that the team leader thinks that they only need to work on X, Y, and Z, but there's an individual on the team that feels a different way. They may not feel as inclined or comfortable coming up and talking about it. So if they were to bring it to me, I would be able to kind of disclose it as a whole without revealing who the individual is. And I had mentioned psychological methods. So with psychological methods, I work primarily with mental skills. So such mental skills are motivation, self-talk, goal setting, and imagery. Those are the four that I mainly like to focus on with my teams, especially with what you're wanting. It sounds like it fits together. And so with motivation, I always work with specifically intrinsic motivation. And intrinsic motivation is specifically from within the individual themselves or from within the team and not from the outside, so like a championship or whatever. And so with intrinsic motivation, say the point guard wants to be able to create a great play and be able to execute it properly and score, then that is an intrinsic goal for themselves, but maybe another individual doesn't have that specific goal. So I want to be able to talk to each of the individuals and see what they are wanting to achieve, and with what they want to achieve, obviously that's something that we're going to use as motivation so that they can reach for that and be successful in that. And then with self-talk is, it sounds kind of silly, but self-talk is how you talk about yourself to yourself. And so how I see things is everything stems from what you think, and what you think is going to pan out onto the court. And so say the team captain, he's a starter, he thinks that today they're playing against a really big rival and they will not win, and it's just kind of a practice game for them, then that's exactly how they are going to treat the game. And even if they did have the potential to win, they will most likely now set themselves up for less of a win because they're already in the mentality that they will lose. And so for them to be able to talk to themselves and say, today I'm going to be able to do this, this, and this, and I'm going to be good at it. And even if it doesn't work out, at least I tried and I was successful. And if I'm not successful, I know what to work on. Because everything stems from, again, what they think. And if one individual is thinking negatively about themselves on the team, 1 out of 5, that can still affect the whole game. And if they're in that type of mentality, it can kind of put them a step back. And then with imagery, again, imagery does sound kind of silly as well. I've worked with imagery a lot during my undergrad years when athletes, such as men's basketball athletes, had injuries and they were afraid to go back. There's an example that I have when I was working during undergrad. We had a starter hurt their ankle and they were out for about 3 weeks. And when they came back, when we were doing functional things during rehab, they were completely 100% okay. They checked out, their strength was there, everything was good. But they were still nervous and hesitant to go back because they were afraid that they would hurt themselves again and that they would not be able to perform at the level that they performed at before the injury. And so with imagery, I would explain to them, I want you to sit there, close your eyes, and picture yourself doing this play perfectly. So say that they're going to do the three steps for a layup and they're afraid of landing on that injured foot. I want them to sit there, close their eyes, and picture themselves doing the 3 steps perfectly with no pain, perfect form, and then be able to successfully do the layup. And when they're able to see themselves from a different perspective from where they're sitting, they feel more comfortable and they're more confident and comfortable in their skills. And it kind of builds up that morale that maybe they were a little hesitant and afraid to go back. And so with imagery, it often does usually work with more for injuries. It also works with just being able to work as a team as a whole. Again, like I had mentioned, like if 1 out of 5 isn't doing well, then the one should be able to picture themselves working together with the other 4 and being able to successfully perform the play at hand. And then goal setting is something that I incorporate into every single plan with each individual and with you as a coach as well. And so I break it up into long-term goals and short-term goals. So long-term goals are more about 4 to 8 weeks, so a little bit longer into the future. So this could be something like a championship season, or being able to make it into the professional leagues, or even the working like overseas or something like that. And then short-term goals is more like 2 to 4 weeks, a little bit shorter, something a little bit sooner during the season itself. And so this could be something like being able to beat the player or the team that you're going to be playing this upcoming weekend and being able to win by 15 points. Or if they're a really, really good team, being able to just win in general. And so every individual person will have long-term and short-term goals. And we could break it down from the coach's long-term and short-term goals, the team's long-term and short-term goals, and also each individual's long-term and short-term goals, because everyone's going to have different types of things that they're wanting to obtain and accomplish over the next couple of months. And being able to only focus on the bigger picture instead of every individual picture will also kind of be more for the team's benefit but not for the individual's benefit. And so wanting to incorporate everybody's voices and letting them know that they're heard is also very important. And then with all these four things, I constantly want to progress them throughout the season, because as you grow and as you achieve things, you want to keep creating new goals to achieve. And so if you don't create new things, you will continue to plateau. And if you're plateauing, you're not growing and you're just kind of stagnant. And so with progressions, I kind of do it by an individual by individual basis. And so say one individual is achieving all their goals that they have put together at a quicker manner than another individual, then obviously we would need to come up with more goals over time, whereas the individual that is achieving their goals a little bit slower, not saying that it's wrong, everyone goes at their own pace, we just need to kind of see how their timeline progresses so that they can achieve also the long-term goals during the time that we are in season or out of season. And then I had mentioned earlier, talking about leadership styles, you had mentioned that your team doesn't always listen to you, and this could just be because of the way that you are approaching practices, approaching talking to them, because some individuals are more of a group effort type of leadership style, and some of them are more one-on-one individual leadership styles. And so knowing how each of your individual team members work together as a whole and separately will also help you form your practices, and knowing who you need to give a one-on-one on versus who you don't need to, and who will thrive as a group during practice and who will thrive with more individualistic skill development practices. And then with this, I also want to highlight that with achievements, you want to always acknowledge your athletes and yourself, any of the achievements that you've made during the time that you guys have had together. Whether it's just having a good practice, that is still an accomplishment. Whether it's winning a championship season, that's a huge accomplishment. But always remembering to highlight the positives, not always the negatives. It's still good to be like, this is not what we want to do, and this is what we should do to become better, because addressing the things that are going wrong will also help you steer you in the right direction. But being able to highlight achievements on and off the court is crucial, because there are individuals that need more of a words of affirmation type of motivation, because sometimes maybe you are the only person that notices these things about them, or aren't so hard on them about these things, and sometimes they are harder on themselves than anybody else. And so being able to acknowledge the things that they have done, even if they even didn't notice, will be really beneficial, because that will build their morale, build their esteem, and hopefully build their confidence. And as their confidence builds, the team's confidence will also build as a whole. My philosophy with sport and exercise psychology is broken into 3 parts. So the first part is understand/educate. The second part is utilize, and the third part is progression. So understanding and education, they kind of go hand in hand, because in order to understand, you have to be educated, and for someone to teach you something, I have to be educated to be able to teach you and have you understand. And so I feel like that's how we can kind of find that median area, because you yourself are a teacher in a sense, because you are teaching your team how to play basketball. I'm teaching you and your team how to be more confident, work on your performance enhancement. And so in a way, we're both somewhat teachers. And so with understanding, I want to understand you and what you're wanting to achieve, your team, what they want to achieve, and each individual on your team and what they're wanting to accomplish. And then education, whatever you are wanting to accomplish with you, yourself, and your team, I want to be able to educate you on how to do so. And being able to educate you on how to do so will help you better understand where I'm coming from and have you buy into my program and be more willing to do it, because I understand that you had mentioned that you guys were very hesitant. And so for me to be able to articulate what I'm doing, why I'm doing it, will help you become more comfortable and more confident in my skills and what I can do for you. Utilizing is kind of self-explanatory. So utilization being able to use the skills that I have taught you guys and being able to use it either off the field, on the court, wherever it may be, whether it's self-talk in your room or if it's imagery right before you guys step onto the court. Being able to incorporate those things into your guys' daily or weekly routines will be very beneficial. And then progression, again, I talk about constantly progressing. Is it working? Is it not working? If it works, then we continue to do it and tweak if necessary or when necessary. But if it isn't working, we need to look at the bigger picture, see what's wrong, what we need to fix, how we can fix it, and then again, incorporating it back into the routine and seeing if it works and constantly changing it where we need to change it before it doesn't work and you're kind of stuck in that same routine.
Okay. What happens if the athlete tells you they have depression and needs your help?
So with depression, that's more of a clinical situation. I'm more of a consultant. I'm more of the educational side. And so with that, I am unable to do anything of that sort. That is not within my expertise. That's not within my education. And so in this instance, such as depression, as you had mentioned, eating disorders or any type of mental disorders, anything outside of sport performance or sport exercise, I would have to refer them to a clinical psychologist, or say if they have an eating disorder, a nutritionist, someone that is better and more well versed in that area of expertise in that topic. I will do what I can on the sport exercise side, say they are struggling with confidence, and that's why their depression is kind of taking over, is they're no longer wanting to play and they're no longer doing anything because they feel like they aren't doing very well, and so they're kind of pulling away. That I can help with the confidence side, I can't help with the depression side.
Okay. What do you do to make sure legally everything is covered? What if a parent asks me about their child?
So with legalities, that is a huge thing. So confidentiality is probably the biggest part of any profession, especially with athletics. And so confidentiality basically means keeping the individual's identity hidden without revealing anything that could target them specifically. So even explaining what sport they play, what position they play, because it doesn't take much to figure out who is the athlete. Because if they know that I'm working at this school and I mention a soccer player that plays at this position, then they can kind of figure out who is coming to see me. And so with this, whenever I discuss any type of information about an athlete, I will not disclose their name or their position or anything like that. I will always talk to them as this individual, this athlete. And with confidentiality, say that you do ask me about a certain athlete, say you're talking about the point guard or something like that. I cannot disclose any information until I speak to that athlete themselves and see if they are comfortable and okay with talking to you or having me talk to you about what's going on. So if you were to ask me about a certain individual, I would go to them and have a conversation with them and say, look, your coach wants to know what's going on. Are you okay with me telling them, or would you like to tell them? And then we would come up with a plan on what to do and how to do it and how to talk to you about it. But if they say no, I cannot force them to do anything outside of their own will. I cannot try and push them or nag them to be able to talk to you about it, because if they say no, I can't disclose any information. The only time that I would disclose any information is if there's going to be any harm to themselves or another individual, or if legal authorities come and need information and documentation. And then you had asked what happens if a parent asks about their child. If the individual is over 18, it is up to the child on whether or not they want to disclose any information. And at a collegiate setting, a majority of them will be at least 18 or older, and so it is up to them. And again, it's kind of similar to how I would talk to you, is I would have to go to them, talk to them, ask if they are comfortable with disclosing that information. And if they are, then we would come up with a plan on whether they would want to talk to their parents, they would want me or you to talk to their parents, or not at all. But again, it is all based on the individual's confidentiality and if they're comfortable and want you if they want you to disclose that information. And then other things that I keep in mind for legality reasons is referrals. I had mentioned that with the depression situation that you had mentioned before, if an individual comes to me and says, hey, like, I think that I'm going through a lot of anxiety and depression. Can you do anything for me? I personally cannot do anything for me, but I can refer them. And most of the time at most universities, and I saw that at your school, you do have a clinical psychologist, you're looking for a sports psychologist, a nutritionist, an athletic trainer, and a strength and conditioning coach. We would all work together to kind of figure out the best route. And so we would all kind of figure out, so say that they came to me with depression and anxiety, I would refer them to the clinical psychologist. But say that they are wanting to work on an injury or something like that, I would work hand in hand with the athletic trainer there. And so it would just depend on the situation that they are coming to me with and what my expertise is in. Because if it's outside of my expertise, again, I have to refer. But that doesn't mean that the athlete can't stop coming. Is required to stop and not see me. And so if they feel like they still want to work on confidence or self-esteem, they can still come and see me. I just cannot talk to them or help them with the other thing that they are going to see the other individual that we refer them to for. And so this isn't to break off any type of relationship or anything that we have together, because sometimes when you cut an individual off from like what I'm doing and they just go and see the clinical psychologist, they kind of forget about working on the other issue and work on their depression or anxiety. And then when say that they have their depression and anxiety under control, the self-confidence and self-esteem has been forgotten about, and it could be worse, and then we have a bigger issue to deal with. And so being able to have that relationship with them and still come and see them, or them come and see you, as long as they're comfortable and they can still go see the other person, you're kind of able to work on the whole thing all together. And then with like I had mentioned, kind of like a relationship, it would be a working relationship. So it would just be a strictly professional student to consultant relationship. The best way to avoid any conflict is if you felt comfortable hiring me, I would only work as your sport and exercise consultant. I did say that I had a background in athletic training, and that I did do that during undergrad, and I am certified. I will not say that they come to me and they're like, oh, actually, I have this issue going on. Can you look at it? And it's not anything sport enhancement or mental skills wise. I cannot help them, because that would become a conflict of interest, because I would be working as a sport consultant and an athletic trainer. And I don't want any type of dual relationship. And if I do that, that kind of creates multiple relationships with the individual instead of separate individual relationships with each person. And then in order to make sure that, again, I'm working on everything and staying within the legalities of everything, I do consult with other sport and exercise consultants without exposing any information about the individual, just to make sure that I am staying within the code of ethics and making sure that everything is still taken care of. So say that there's a situation where I'm like, I'm not sure if I should report this or not, I would go to another sport consultant and be like, hey, this is a situation that's going on. Am I doing everything right? Should I refer them? I feel like I need to. So that I have another set of eyes within the same profession. Because if I were to ask a random, say, a strength and conditioning coach, they don't know the legalities that go into our profession compared to their profession. And so just being able to maintain that professional relationship and being sure to make sure that you are covering everything, I would consult with another sport and exercise consultant.
Okay, that is all I have for today. Thank you again.